Is Jin, and I'll be doing my presentation on the influenza virus today. Influenza, also known as the flu, is a highly contagious viral respiratory illness that affects the nose, the throat, and sometimes the lungs. Influenza spreads easily through the respiratory droplets when infected individuals cough, sneeze, or talk. It can also be contracted by touching surfaces contaminated with the virus, then touching the face. Influenza is categorized into different types and subtypes based on the variation in the surface proteins, namely humatagglutinin and neuraminidase. The most common types that affect humans are influenza A, subtypes H1N1 and H3N2, and influenza B. Seasonal influenza occurs annually, typically during colder months, leading to outbreaks or epidemics. It poses a significant burden on the public health, causing increased hospitalizations and deaths, particularly among high-risk groups. Symptoms of influenza can range from mild to severe and usually manifest within 1 to 4 days after infection. Common symptoms include onset of fever, chills, cough, sore throat, nasal congestion, muscle or body aches, headaches, fatigue, and sometimes gastrointestinal symptoms. Influenza can lead to complications, especially in vulnerable populations. These include pneumonia, bronchitis, sinus infections, ear infections, exacerbation of underlying medical conditions, and in severe cases, respiratory failure or death. Annual vaccination is the most common, most effective preventative measure against influenza. The flu vaccine is formulated each year to target the most prevalent strains expected to circulate. It significantly reduces the risk of infection, severe illness, hospitalization, and transmission of the virus. Antiviral medications such as Tamiflu can be prescribed to treat influenza, especially for those individuals at higher risk or those with severe symptoms. These medications help reduce the duration and severity of the illness when taken early. In addition to vaccines, practicing good respiratory hygiene, like covering your mouth when you're sneezing, frequent hand washing, avoiding close contact with sick individuals, staying home when unwell, and regularly disinfecting frequently touched surfaces are essential preventative measures. Influenza pandemics occur when a novel strain of the virus emerges and spreads globally, resulting in significant illness and death. The 1918 influenza virus, the Spanish flu, was the most severe in recent history, causing devastating impact worldwide. The symptoms of influenza typically appear 1 to 4 days after infection and can range from mild to severe. The following are the signs and symptoms commonly associated with influenza. Influenza often presents with a sudden onset of high fever, usually above 100.4 degrees Fahrenheit. Fever is one of the hallmark symptoms of influenza. A persistent and dry cough is a common symptom of influenza. The cough may be severe and can last for several weeks even after other symptoms have resolved. Influenza can cause sore throat, which may be mild to moderate in intensity. The throat may feel scratchy, irritated, or even painful. Many people with influenza experience nasal congestion, a runny nose, or both. This symptom is similar to the common cold, but is often more severe with influenza. Influenza can cause generalized muscle or body aches, also known as myalgia. These aches can be widespread and may affect the back, arms, legs, or other areas of the body. Headaches are common and can range from mild to severe. They can be accompanied by a feeling of pressure of tightness in the head. Influenza can cause extreme tiredness and fatigue, which can be debilitating. Even simple tasks may be exhausting, and the fatigue can persist for several weeks after the acute illness. Weakness and a lack of energy are common during an influenza infection. It can make daily activities challenging and contribute to overall feelings of illness. Many individuals with influenza experience chills and shivering, particularly during the early stages of the illness. Chills are often accompanied by fever. Sweating is common during influenza, especially during episodes of fever and chills. Sweating can contribute to the feelings of discomfort and fatigue. In some cases, especially young children, may also experience gastrointestinal symptoms such as nausea, vomiting, and diarrhea, although these symptoms are more common in children than in adults. Influenza is divided into three types: influenza A, B, and C. The cause of influenza involves a mix of factors, including genetics, infectious agents, and where you live. Influenza viruses are the main infectious agents that cause influenza. Influenza A and B viruses are the most common types that make people sick. These viruses can change and mutate over time, which is called antigenic drift and antigenic shift. These changes contribute to the seasonal nature of influenza and the need for regular updates to the flu vaccine. Genetics play a role in determining how likely someone is to get influenza and how severe their illness might be. Certain genetic differences in our immune response genes, called human leukocyte antigen genes, can affect how well we fight the virus. Genetic factors also influence which strains of the influenza virus are present and how easily they can affect different populations. Our immune system's response is important in deciding how well we'll fare against the influenza. It's influenced by a mix of genetics, previous exposure to the virus, and our overall health. Things like age, existing health conditions, and the strength of our immune system can affect how bad our symptoms will be and how long it'll last. Geography plays a role in how influenza spreads and when it's most common. In colder regions, influenza is more common during the winter months, leading to seasonal outbreaks. The reason for this isn't fully understood, but it may have to do with things like lower humidity and more people gathering indoors in colder weathers. In warmer regions, influenza can happen at any time of the year without a specific pattern. Influenza mainly spreads through droplets that are released when an individual affected with the virus coughs, sneezes, or talks. The virus can also survive on surfaces and objects, so touching those, then touching your face can lead to infection. Factors like being close to infected individuals, crowded places, and not practicing good respiratory hygiene contribute to the spread of influenza. Increased travel and globalization have made it easier for influenza viruses to spread quickly across different regions and continents. People traveling from one place to another can introduce new strains of the virus, leading to outbreaks in specific areas or even worldwide pandemics. Because the world is so interconnected now, it's important to monitor and track influenza strains to take appropriate preventative measures. Influenza pathophysiology involves a series of complex events that affect the respiratory system and can have systemic effects. Influenza viruses enter the body through the respiratory tract when we inhale respiratory droplets containing the virus. These viruses attach to specific receptors on respiratory epithelial cells in the nose, throat, and lungs. Viral replication. Once attached, influenza viruses enter hosts and release their genetic material, RNA. The viral RNA takes control of the host cell's machinery to replicate and produce new viral particles. Viral replication damages the host cell, leading to their death and disruption of the respiratory epithelium. This triggers an inflammatory response in the respiratory system, releasing pro-inflammatory cytokines, chemokines, and other mediators. The respiratory system's inflammatory response attracts immune cells like neutrophils and macrophages to the infected site. These immune cells release additional inflammatory mediators and engulf viral particles in infected cells. Lesions and epithelial damage. The combination of viral replication can damage and inflammation can cause small lesions and ulcers in the respiratory epithelium. These lesions contribute to symptoms such as sore throat, coughing, and difficulty breathing. Systemic effects. In severe cases or individuals with underlying health conditions, the inflammatory response can spread beyond the respiratory system, leading to systemic effects. This includes the release of pro-inflammatory cytokines into the bloodstream, resulting in cytokine storm. The storm can cause widespread tissue damage and organ dysfunction. In rare instances, certain highly pathogenic influenza strains can cross the blood-brain barrier and infect the central nervous system, leading to neurological complications like encephalitis or meningitis. The immune system mounts an adaptive response against the influenza virus, producing specific antibodies that neutralize the virus and clear the infection. The immune response, combined with cessation of the viral replication, eventually leads to the resolution of the infection and the individual's recovery. Diagnosis of influenza involves a comprehensive approach that includes clinical evaluation, symptom assessment, and laboratory testing. Clinical evaluations. The healthcare provider begins by thoroughly reviewing the patient's medical history, including symptoms, onset, and duration of illness. They also inquire about any potential exposure to individuals with confirmed influenza. A physical examination is conducted to assess signs such as fever, respiratory symptoms, and overall clinical presentation. Influenza is typically characterized by a sudden onset of symptoms including fever, cough, sore throat, body aches, fatigue, and headache. These symptoms can help distinguish influenza from other respiratory infections. The healthcare provider asks about the presence and severity of these symptoms to evaluate the likelihood of influenza infection. Rapid influenza diagnostic tests can be performed in healthcare settings to quickly detect the presence of influenza viral antigens. These tests utilize nasal or throat swabs to collect respiratory secretions. RIDTS provides results within 15 to 30 minutes, but their sensitivity and specificity are moderate compared to more advanced laboratory tests. Reverse transcription polymerase chain reaction is a highly sensitive and specific laboratory test used to identify the presence of influenza viral RNA in respiratory samples. Nasal or throat swabs, nasopharyngeal swabs, or respiratory secretions are collected and processed in specialized laboratories. This test can determine the specific subtype or strain of the influenza virus, which is crucial for surveillance and monitoring purposes. Serological testing. Serological testing examines the presence of influenza-specific antibodies in blood samples. While this type of testing is not commonly used for acute influenza diagnosis, it can be valuable for retrospective diagnosis, seroprevalence studies, or determining previous exposure to specific strains. When managing influenza, various strategies are employed to alleviate symptoms, prevent complications, and curb the spread of the virus. The primary goal of influenza management is to alleviate symptoms like fever, cough, sore throat, body aches, and fatigue. Over-the-counter medications such as acetaminophen or non-steroidal anti-inflammatory drugs can effectively reduce fever and relieve pain. Cough suppressants and throat lozenges offer temporary relief for cough and sore throat symptoms. Adequate rest is crucial for recovering from influenza, as it allows the body to conserve energy and channel resources towards fighting the infection. It is important to maintain hydration by drinking plenty of fluids such as water, herbal tea, or clear soups, which helps prevent dehydration. Healthcare professionals may prescribe antiviral drugs for treating influenza, particularly in individuals at high risk of complications or severe illness. Medications like Tamiflu, Relenza can effectively reduce severity and duration of symptoms if initiated early in the course of the illness. Antiviral treatments can also help prevent complications and reduce the risk of transmitting the virus to others. Annual influenza vaccination is strongly recommended for individuals aged 6 months or older. Influenza vaccines provide protection against specific strains of the virus, effectively reducing the risk of infection, severe illness, and complications. Vaccination is especially crucial for individuals at high risk of complications, including the elderly, young children, pregnant women, and individuals with underlying health conditions. Practicing good respiratory hygiene, such as covering the mouth and nose with the tissue or elbow when coughing or sneezing, is crucial in preventing the spread of influenza. Regular hand washing with soap and water or the use of hand sanitizers significantly reduces the risk of transmitting the virus. Sick individuals are strongly advised to stay home, avoid close contact with others, and adhere to public health guidelines. Prognosis of influenza can vary based on several factors, including age, overall health, underlying medical conditions, and the specific virus strain. Generally, the majority of individuals with influenza experience a self-limiting illness and recover within 1 to 2 weeks without complications. In uncomplicated cases, the prognosis is favorable, and individuals typically regain full health without long-term effects. However, certain populations, including young children, older adults 65 years and older, pregnant women, and individuals with weakened immune systems or chronic medical conditions, are at higher risk of developing severe complications. Severe complications of influenza can include pneumonia, bronchitis, sinus infections, ear infections, exacerbations of pre-existing medical conditions, and in rare cases, multi-organ failure or even death. Following influenza infection, a secondary bacterial infection like bacterial pneumonia can occur, contributing to a more severe illness. Influenza can also worsen underlying chronic medical conditions such as asthma, chronic obstructive pulmonary disease, heart disease, and diabetes. Annual influenza vaccination significantly reduces the risk of severe illness, hospitalization, complications, thereby improving the prognosis of vaccinated individuals. Prompt medical attention, appropriate antiviral treatment, and supportive care play crucial roles in managing severe cases and improving outcomes. The epidemiology of influenza virus involves studying its occurrence, distribution, determinants within populations. Influenza is a highly contagious respiratory illness that affects millions of people worldwide each year. It causes seasonal epidemics, with varying levels of severity and can also lead to occasional pandemics. Seasonal influenza occurs annually, typically during colder months in temperate regions, and throughout the year in tropical regions. In temperate climates, influenza activity often reaches its peak during the winter months. Influenza viruses are classified into types A, B, and C. Types A and B are responsible for most cases of seasonal influenza. Influenza A viruses further subdivide into different subtypes based on specific surface protein known as hemagglutinin and neuraminidase. Influenza A viruses can undergo genetic changes through antigenic drift, which is a minor change, or antigenic shift, a major change. Antigenic drifts lead to the emergence of new strains within a subtype, while antigenic shifts result in the introduction of a new subtype or novel virus with pandemic potentials. Influenza epidemics occur annually, involving the circulation of specific strains within a population. In contrast, influenza pandemics occur when a novel influenza virus emerges, to which the population has no pre-existing immunity, resulting in widespread global outbreaks. As mentioned before, influenza spreads through respiratory droplets produced when infected individuals cough, sneeze, or talk. It can also be spread by touching contaminated surfaces and then touching the nose, mouth, or eyes. Certain populations are more susceptible to severe illness and complications from influenza, including young children, older adults, pregnant women, individuals with weakened immune systems, and those with underlying medical conditions. Vaccination is the most effective preventative measure against influenza, reducing the risk of illness, severe complications, and transmission. Other control measures include practicing respiratory hygiene, maintaining hand hygiene, and using antiviral medications for treatment and prevention in specific cases. Ongoing surveillance systems are crucial for monitoring influenza activity, detecting new strains, and informing the public. Surveillance data help guide vaccine strain selection, monitor antiviral resistance, and assess the impact of intervention. The history. The discovery of influenza. In 1933, a British physician named Richard Jalota achieved a groundbreaking milestone by isolating the first influenza virus from pigs. Jalota's discovery laid the groundwork to our understanding of influenza as a viral disease. Initially, the diagnosis of influenza relied primarily on clinical symptoms and physical examinations. In 1930, serological tests like complement fixation tests were introduced, enabling the detection of influenza antibodies. Over time, diagnostic methods have evolved, including the development of rapid diagnostic tests, polymerase chain reaction, and viral culture techniques. Notable historical cases. The Spanish flu, 1918 through 1919, one of the most devastating pandemics in history, caused by an influenza A H1N1 virus. It impacted millions worldwide and had a particularly high mortality rate among young adults. The Asian flu, 1957 through 1958. Another pandemic caused by influenza A H2N2 virus, originating in East Asia. It particularly spread globally, resulting in significant illness and mortality. The Hong Kong flu, 1968 through 1969. It's a pandemic caused by, once again, influenza A H3N2 virus. It emerged in Hong Kong and quickly decimated individuals, leading to widespread illness and fatalities. Extensive research has been conducted on the influenza virus, leading to significant advances in our understanding. Virus structure and function. So researchers have extensively studied the structure and components of the influenza virus, including its surface proteins such as humatagglutinin and neuraminidase, as well as its internal genetic material. Understanding the intricate details of the virus's structure enables the identification of potential targets of antiviral drugs and the design of effective vaccines. Vaccine development. Continuous efforts are made to develop and improve influenza vaccines, enhancing their effectiveness and coverage. This involves identifying the most prevalent strains for inclusion in the vaccine, exploring new vaccine technologies such as recombinant vaccines, and evaluating vaccine efficacy and safety. Research is focused on development of antiviral drugs that can effectively inhibit the replication of influenza virus, thereby reducing the severity and duration of the illness. Drugs like Tamiflu, Influenza, which target the neuraminidase enzyme of the virus, have been developed as a result of such research. Recent studies have been dedicated to understanding the interactions and co-infections between influenza and COVID-19. This research helps shed light on the impact of these combined infections on healthcare systems, as well as guiding public health responses to effectively manage both viruses. Famous people that had contracted the influenza virus. The former president, Franklin D. Roosevelt, who was the 32nd president of the United States, contracted influenza during the 1918 Spanish flu. Walt Disney, a renowned animator, film producer, and the founder of Walt Disney Company, reportedly contracted influenza during, again, the 1918 Spanish flu pandemic. And that ends my presentation about the influenza virus. Thank you.